Okay, so good evening, everybody. This is Mukul Anil Chimote, Executive Director from Astute Career Counseling Academy, and we Cogent EduTech Incorporation, United States of America. So basically, we are a US firm and having our own office in Chicago. Our Indian subsidiary is Astute Academy, having our offices at Mumbai, Pune, Nagpur, Vadodara in Gujarat, and Jabalpur region also in Madhya Pradesh. So basically, we are education reformists, career counselors, guiding the students right from 9th to PhD for all the streams. And whatever careers are coming, a lot of changes are happening across the globe in the education sector. So accordingly, we are guiding the students for further pathways, analyzing their skills, their abilities, their interest areas, and then planning for them the proper careers also. We don't represent any of the universities, and we are a group of academicians across the countries. Around 20 countries representations are there with us. And Dr. Tushar Vinod Devras, he started this academy. He's a founder director of this academy and ex-scientist of Baba Atomic Research Center. He started this academy 27 years back, and in Pune. And now we have a US office also. Shortly, we will be starting our office at Germany also. So, as far as medical career is concerned, we are guiding the students for undergraduate pathways as well as the postgraduate for the studies also. For getting the admissions in best of the universities across the globe, especially in United States, as well as admissions without donation in India. So we are also handling the complete processes in India in a very, very transparent manner as per the legal parameters given by the government of India, and guiding the students for all this processes and helping them to get the admissions without donations. So today is a very, very interesting topic, and a lot of students are having the target of pursuing the US residency program and settling down in United States or have a quality education. And this is a premier pathway. US is a premier education system across the globe, and it provides ample opportunities for his individual to enhance his professional skills and to have a global exposure and to pursue globally accepted degrees. USA degrees are globally accepted. So my name is Mukul Anil Chimote, and I'm also Art of Living faculty associated with Art of Living since last 17 years, and conducting a lot of skill workshops, corporate trainings also. I was also involved in a lot of social initiatives at the village level, river rejuvenation projects and all that. And as far as counseling is concerned, I have more than 23 years of experience of the career counseling. And that's all from my side. This is my introduction, and now we will move forward. Yeah. So basically, every professional have an aspiration to become a good doctor, professional, having a great professional expertise to acquire knowledge, and everybody wants to do some seva for the humankind, to serve the nation, to serve the society in a proper manner, and basically with proper knowledge, with good research exposure. It is always will be very, very helpful for each individual to go to great heights in his career and to serve the society also. So basically, now the 6 countries in the world, that is India, United States of America, UK, Australia, New Zealand, and Canada. These are working very closely to upgrade the medical system, especially after the Corona period. Now, a lot of awareness is there regarding having a proper health infrastructure to serve the society in cases of emergency, and everything should be have a proper infrastructure with proper quality doctors, treatment modules, and everything. So these countries are working very closely with each other, and a lot of changes are there in the education system, in the admission procedures also. So basically, everybody wants to treat the patient in a proper manner with giving the best of the qualities of treatment to the patient. And also, all these programs we are also conducting to have ease in getting the medical PG admissions, basically. Because with specializations only, we can have a ample knowledge of a subject, a particular subject, and then we can practice in a specialized manner for that. So we have our center in United States of America in Chicago, and basically we have our affiliated residency hospitals in the Vineland area in the with a group of very great doctors, academic doctors, and basically we know in and out about the residency hospital admission process because of so many years of experience with such a expertise available for guidance, who know in and out about it. So we are in a very in very proper manner we can guide the students for further processes to strategize the admission. Lot of analytical and strategic approach is required to get the admission into the residency programs, and we are in the best position to do it and consistently doing it for the students. As per our belief is that the quality education and successful career is the fundamental right of every student. So irrespective of his financial credentials, irrespective of his academic credentials and all that, we believe that in any sector of education, the student should get best of the education, affordable education. And for that, we are consistently putting our efforts. We have received lot of national and international awards. So Champions of Change Award at the hands of our then Vice President of India and Rajya Sabha Chairman, Shri Venkaiah Naidu ji. So this was the award given to us by Niti Aayog, the Planning Commission of India, and the chief jury was the ex-Chief Justice of India, Balkrishnan ji. So very prestigious award. Pride of the Nation award was given to us on the Vijay Divas, very auspicious day in the history of Indian Army at the hands of our Honorable Defense Minister Shri Rajnath Singh ji, and CSI General Excellence Award at the hands of then Chief Minister of Maharashtra Shri Devendra Fadnavis ji, Maharashtra Gaurav Award at the hands of Nitin Gadkari ji, and the Cabinet Minister. Uttar Maharashtra Ratna Puraskar. This was the award given to us by Chief Minister Shri Devendra Fadnavis ji, and this was given to us in 2017, and alongside us Swargiya Lata Mangeshkar ji and Pratham Mahila President of India, she first President of India, Pratibha Tai Patil. They were also awarded with this similar award. So this was a very prestigious award for us. In UK Parliament, House of Lords, similar to our Rajya Sabha and Lok Sabha. So in the House of Lords, we were felicitated for our services at London in the field of education. I have received multiple awards, International Iconic Achievers Award at Moscow, Russia in 2019, Best Career Counselor Award in Maharashtra at the hands of Eminent Research Foundation, Mayor's Innovation Project at Nagpur for my contribution in the field of education. So all these awards are not about sharing, it is all about inspiration to work in a more dedicated manner for the society and for the welfare of the students. So as I shared earlier, Dr. Donald C. Martin, ex-dean of Columbia University, Ivy League, ex-dean of Booth School of Management, the #1 management college in the world, and University of Chicago. He's our associate director there with more than 40 years of experience in the field of education. So very, very professional expertise available for guiding you in a proper manner, plan your proper career pathways, to do the gap analysis of your profiles and accordingly plan the strategies for you. So first I will just now, since the NEET PG is round the corner, I will be just giving a brief information about the scenario in India also, so that we can have a comparative statement for both the opportunities. In India, government institutions, around 50%, in all 70,000 seats are there as per the statement by the Health Minister of India, Mansukh Mandaviya ji, in the Rajya Sabha and Lok Sabha. Around 70,000 seats are there, and around 2.5 lakh students generally appear for the NEET PG examination. Now, in future, this NEET PG examination will be replaced by the National Exit Examination, mostly in 2025, which will be the licensing examination in India. And every student, irrespective of his education within the country or outside the country, will have to give the licensing examination. And special exemption has been given to 5 countries: America, Australia, Canada, Great Britain, and New Zealand. So the license holders from these countries can directly work in India with whatever specializations they are having. So in India, 50% seats are there for the all India quota in the government colleges, and balance 50% are generally for the state quota for the state governments with all the reservations. Around 66% reservation is there centrally for the all the quotas. In Maharashtra, state of Maharashtra, around 7 after the implementation of Maratha quota, it will go to around 71% of reservation. So each category has very less number of seats. Around 32 specializations are available, and there generally the student can apply to the 50% all India quota, then 50% state quota as far as the category, and then private institutions in India. So every state has their own counseling authorities, and they have their own set of rules or regulations. So state wise, every state have different provision for the admission process. And many states have the non-domicile category also, where you can apply to the private institutions. So because in PG, very less number of seats are available for particular specializations, and really you will have to apply to, and cost of education is very, very high in India. The average cost of education is between 50 lakhs to 2.5 crores, 3 crores, considering all the fee structures and all that. So very difficult process, complex process. In fact, last year, the 0 percentile was the criteria of eligibility, because lot of seats, specifically non-medical branches and all that, were vacant. I will ask everybody to mute. And in private institutions, every state have their own form, and it is possible that next year the centralized procedure will be there, but with the state regulations. So no domicile is required in a lot of states. As far as Maharashtra, Gujarat like states are concerned, so they have they require the domicile for the PG admissions also. But in the PG, seats are very, very less. Deemed universities, all India centralized admissions are there through the counseling rounds. Even for the management quota or an NRI quota, you will have to apply through the transparent process, to the following all the regulations. There is no need to give any sort of donations for that, and we guide the student for this. And admissions in the second round are very, very critical, because if you will not strategize it, all your deposits will be forfeited, and you will be out of the rounds from the second or third round exit. So you will not be eligible for the further rounds. So a lot of new regulations will be coming. So we will be guiding the students according to that. Very, very critical, and you need to strategize it. Financially also, you should have lot of plannings, and you should also take into budget the money you will require for practicing in India. So UG plus PG cost plus practicing. So all this budget should be there, and it is very, very costly affair because of the rarity of government seats available for the students. So proper strategic approach is required. So and our PG is not globally accepted. So now this is the era of globalizations. To improve your knowledge also, you should have the global knowledge gates open up for you. You should be able to perform surgeries or work anywhere in the world. And for that, you should have a target of pursuing a globally accepted degree. So National Medical Commission also accepts, as I told you earlier, shared with you earlier, that USA, UK, Australia, Canada, and New Zealand degrees are directly accepted in India, and they can directly practice here with our whatever specializations are there. Generally, a lot of students are perceiving the UK pathway or United Kingdom. So in United Kingdom, the PLAB will be replaced by the UKMLA. Now it is replaced, and it is an interview based system basically, where first you will have to get the GMC registrations there, and after that first you will have to clear the PLAB or the UKMLA, whatever examinations are there, do the internships, then go have a general GMC registrations. And after that, everything is based on your profile. You need to improve your academic and non-academic profile, your research, your publications, everything. And everything is based on the interview basis. Australia is also following the similar pathway. In Canada, basically, it requires the permanent residency. PR is required for Canada presently. Unless you have a PR in Canada, you cannot practice there. And USA is quite open up. It has got a different system as far as the admissions are concerned, and it is a bigger country. So lot of institutions are there around, lot of programs are there with proper chance for a student to evaluate his chances, to plan strategically to get the admission into that. And it is based on the basically rank order list, what rank order list you are making. It is very, very important aspect of that. Along with your profile, your marks in USMLE statement step 2, academic, non-academic profile, publications, rotations, having the letter of recommendations and everything. But USA is surely the #1 destination in the world. So the new Mool mantra of medical education is that if you can diagnose the patient, then you can treat the patient. Clinical exposure is the key for the success of a doctor. It is very, very critical to have a proper clinical exposure, to have enhanced your clinical skills. Utmost importance is there for that. And as I told you, India has already, we are following as per the new education policy. Now we are implementing our ancient knowledge system. We are following the US education system now. Multidisciplinary approach in the education is there in India. And similarly to the USMLE step 1 and step 2, we have introduced the licensing examination in India, that is national exit. Now USMLE weightage is reduced to 15 to 20%, as step 1 is only pass and fail examination, and they have scrapped or discontinued the CS part. And now maximum applications are through the pathways. 6 different pathways are there to have a ECFMG certifications and all that. So USMLE weightage is considerably around 15 to 20%, and 80 to 85% is on your profile, and they will be testing your clinical skills and everything. As I told you, PLAB has been replaced by UKMLA, and Australia has already AMC already changed. They have restructured the AMC also. So lot of restructuring is going on. So USA basically minimum degree to required to practice is the post graduation is the minimum qualification to practice in United States of America. So USA offers you 2 programs. One is the residency program, which is a #1 program in the world, and secondly is a physician associate program. Very, very unique opportunity for the students. Physician associate program, which is a non-USMLE route to practice medicine in United States of America. So it is a master's degree program of 2 to 3 years. So I will be giving the details regarding this in my further slides. So www.aapa.org. So you go to this official website of Physician Associate Program. Previously, it was called as Physician Assistant Program, and it is a medical PG program, very prestigious program in United States of America. And what is currently they are licensed as a clinicians, and they are handling all type of treatments, primary health care there, doing all the type of procedures, prescribing the medications, doing the patient counselings, doing the minor surgeries, procedures as well. Very prestigious, highly paid jobs are there, very with almost all the specializations available for you. So right from internal medicine, pediatrics, gynecology, all the specializations are available. And currently, this profession was established in United States of America in 1967 and Canada also. And approximately currently 1,68,300 PAs are there in United States of America with more than 500 million patient interactions per year. So very great profession. Around 260 physician associate programs are there in United States, and the international medical graduate can apply to around 175 universities with more than 2,000 of exposure to 2,000 hours of clinical rotations are there. So this program is typically for 24 months to 3 years program. Average program duration is around 27 months, and you are educated as a master's degree holder in the United States of America. So after the completion of the physician associate program, you will be giving the licensing examination that is called as PANSE, Physician Associate National Certification Examination will be there. And around 95% is the passing rate into this. And then you will get the license to practice in United States of America. And every 10 years, there is a process of re-certification. Means you need to upgrade your skills. United States is the proper, it is a norm for residency also. Continuous education or upgradation in your skills is required. Research is required. So it is a norm there in the United States. Now, PAs are practicing in every work setting in the United States of America. Around 35.4% in the hospitals, around 5.2% in the urgent care centers, 7.2% in other specializations, 52.2% in the outpatient departments, OPDs. Now, as far as the specializations are concerned, so PAs are having 21% are there in the primary care, 12.2 in the internal medicine subspecialties, 8.4% in the emergency medicine, 1.5 in the pediatric subspecialties, 35.5 in other specialization, and 26.4 in surgical subspecialties they are working. So basically, 2 years to 36 months. Most of the programs are around 27 months duration, and you can now apply in 175 universities, basically. So I will also give a wonderful, basically survey was conducted by the US News and World Report 2021. And PA is amongst the best job, #1 job in the 100 job list. They numbered PA as a #1 job in the United States of America. According to the US News and World Report, is a best healthcare job in the United States. And fastest growing jobs in America, it was ranked 5th. So as per the Bureau of Labor Statistics in 2020. So very handsome salaries, great salaries. So basically, starting salaries are at around $1,25,000 to $2 lakh per annum. Means around average salary is around 1 crore plus in the United States of America for the physician associates. And the selection criteria, I will be elaborating on that. So what are the criteria of eligibility? Who can take these programs? So what are the requirements? So basically, your Indian degrees, you will have to do the WES evaluation, and after the WES evaluation, your prerequisites, you will have to complete the prerequisites from India. You can complete it in an online mode through the accredited United States universities, or you can also take that prerequisites in United States also. So with a clinical profile of around 2,000 hours of clinical exposure, 250 to 2,000 hours of clinical exposure is required for this. So eligibility, the most of the students from the MBBS, those who have completed their MBBS in India, having the goal to settling down in the United States, the students who have perceived or perceiving their medical education other than abroad, in the abroad countries like Russia, China, Kyrgyzstan, and all these countries, they can also think about this. Now, US education is all about the number of credits. I will share with you wonderful information. One of our physician, senior faculty member, that is Dr. David Kaufman. He is a humanities graduate, and now he is a big number one infection specialist in United States of America in the New Jersey area. So it is all about the credit facilities. It is all about the number of credits you are taking. So you will have to match the prerequisites. Whatever prerequisites are less, you can complete that prerequisites and then you can go for the program. So anybody can do. It is a very, very multidisciplinary approach is there in the United States. It is not about, don't have a thought it is a substandard then residency and all that and all that. It is a very, very prestigious program. Those students who have done the Ayurveda or dental or homeopathy or physiotherapy or occupational therapy, biotechnology and all that, because pre-medical part is there in the United States. There is always a pre-medical, and after that the MD program, DO program or PU program is there. So basically it is all depending on the credit system. So all these are eligible to practice allopathy in United States of US, America. So what are the prerequisites? Generally you will have to score around 3.5 GPA in each subject in this, and generally there is 100 level of each subject, 200 level of subject, 300 level of subject. So they match the level of your education, and accordingly you will have to complete these prerequisites. So these are anatomy, physiology, biochemistry, microbiology, chemistry, organic chemistry, genetics, medical terminology, psychology, statistics, healthcare experience. Generally the subjects with a laboratory have a 4 credit value, and without laboratory it is a 3 credit value. So generally total is 32 credits of prerequisites are generally required to go into the PA program. Other requirements are some standardized examinations are there, like GRE examination. So GRE is a very, very standardized examination which is given by all the streams. Even if the students is going for the commerce related subject, non-STEM subject or STEM subjects, they are giving GRE examination. So around 300 marks score is required. TOEFL examination is there for that. In some universities, you will have to give the CASPER, that will test your behavioral tendencies that regarding the medical ethics part. The examination is based on the medical ethics. And the fourth is the PA CAT examination. So this will test, it is a test of evidence-based assessment of an academic preparedness of a candidate. So basically, though not mandatory for all the universities, but we always advise to give this examination so that you can go into best of the programs. You can try for a lot of scholarships also. So, and then the PA interviews, they are very, very critical part. So PA interviews are there. Very, very competitive program. Each program has at around 30 to 32 seats for international students. So we need to match your profile with the requirement of the universities, and then go for the program and do the applications part and prepare for the interviews. You need to have some rotations. You can do some shadowing activities and have some letter of recommendation also. Virtually also you can take some clinical rotation from United States of America for this. And a great program. Generally 3 admission cycles are there. August cycle is there, Jan cycle is there, and March cycle is there. So what are the specializations available? So family medicine, internal medicine, pediatrics. This will come under the primary care. As far as the internal medicine subspecialties are concerned, so right from cardiology, critical care, endocrinology, gastroenterology, hematology and oncology, infectious disease, nephrology, neurology, pulmonology, rheumatology, all these branches are available. As far as emergency medicine, pediatric emergency medicine, and other specialties are concerned, so you can go for obstetrics and gynecology, ophthalmology, psychiatry, radiology, pain management, dermat, genetics, allergy and immunology, as far as surgical subspecialties are concerned, so right from cardiovascular and cardiothoracic surgeries, bariatric surgeries, colorectal surgeries, general surgery, neurosurgery, oncology, orthopedic surgery, urology, transplant surgeries, all these specializations are available. Even the students, if some of your siblings are there who are appearing for the NEET and all that, they can directly go to the United States for the 6 years of integrated program. Where they will go into the pre-medical part, that is a pre-PA part, and followed by the PA program. And they will, within 6 years, they will have the license to practice in the United States of America. Great program, great opportunity. So, what are the program highlights? So, it is amongst the top 3 professions in the United States of America. Very high job opportunities for all of you. Non-cap H1B and speedier green card processing. The H1B does not have a capping here for this category of visas. Curriculum practical trainings means every student during his master's program can have a professional exposure with the part-time payments also, where he can earn his living there in United States, do the very prestigious jobs. And after completion, since you will come under the same category, you will be having an optional practical training after completion of masters. So same students are allowed to go for 3 years of professional experience in the field of healthcare with salaries as per the United States laws around 1.25 to 2 lakh dollars per annum, and the hospitals will be sponsoring for you the H1B visas. Great opportunities. Even lot of scholar, and the beautiful thing about this is that now since the post corona, now the prerequisites can be completed from India also through the online mode from the US accredited universities. So this can save lot of cost for the program also, and lot of scholarships are available in the United States based on your academic and non-academic profile. They will be evaluating your profile, and timing of application is also very critical part of this. And education loans are very easily available for the programs, and the repayment will be starting post completion with the 3 years of moratorium. In the fourth year of after completion, in the fourth year, the repayments will start. Even if you have some relatives in the United States of America, you can get the education loans at far cheaper rate than India, at 2 to 3% to 4% per annum rate of, and always in India also the interest is chargeable on the disbursed amount, not on the sanctioned amount. So lot of scholarships are also on offer. So basically you will have to dedicate 1 full year for this, for completing the prerequisite. The more time you will give, faster will be the completion of the parameters, and you can target the next cycle either in Jan or March, and you can fly down to the United States also. If you are not comfortable in the online mode, you can take this in the offline mode also, but that will cost you around $1,000 to $1,200 per credit will be the cost for that, and you can perceive the prerequisites from the United States universities in the offline mode also. And in the online mode, it will cost you around $400 per credit only. So you are saving lot of cost, around $800 per credit. So that is the thing. Now it is available for you. Even those students who are pursuing MBBS or any related degrees, they can start the prerequisites during their graduations, and they can then go for the master's program and their integrated program, and then they can complete the prerequisite, and immediately they can go for the physician associate program. In fact, we have now started our pre-medical program in India as per the US standards at the Parul University in Vadodara. So in collaboration, we have launched this batch there for the prerequisites. This is for the students who are in the 12th. After 12th, those who are want to go for United States. For them, this prerequisite batch will be there, and Parul for 4 years of batch will be there. Some 5 years integrated programs are also available for you. So that you can directly fly to the United States in August for pre-PA as well as PA programs. This is also available for you. So generally the course starts in Jan, March and August. So according to the parameters, completion of parameters, we will be targeting the next admission cycle. So great program. You can surely think about this. Many students are stuck up and they are not finding the pathways for further progress. So you can surely have a great career path. And the beautiful thing about the physician associate program also is that if during this, if you are not confident or you are having very much gap in your basic MBBS degree and residency admissions are also difficult. So you can simultaneously give the USMLE step 1, step 2 in United States of America. So you will be having a clinical exposure and clinical degree in United States that will really improve your chances of residency also. And after PA programs, you can also go for the PhD programs there. You can go into the research and super specializations are also available. So very great program. You should surely think about this. It is better than FDMS in India. Now, as far as the residency program is concerned, total admission process is changed. Lot of analytical and strategic approach is required to have a successful admit to get a match in United States. And it is a free program. It is a federal government funded program with around $5,000 to $10,000 per month is a stipend. So whatever education cost you have paid during the you have made during your undergraduation in India or any abroad countries, that can be easily repaid through this stipend. And you can also have a professional skill enhancement, global exposure for research. Third, you can have a capital investment ready for your Indian ventures after some years of time. And this can the knowledge will really help you to upgrade your skills. Plus, it can also you can also participate in nation building activities in India to facilitate to provide proper facilities to the crowds and to the society with latest technology. So all this is possible through the residency program, number one program in the world. So as though it is the lowest qualification to practice in USA, every MD students there means and doctor of osteopathy student will have to apply for PG. Unless he completes his PG, he is not eligible to practice in United States. Still, 2,000 seats were vacant last year. If you will go to the nrmp.org, I will be sharing certain results with you. 2,000 seats were vacant in surgical and clinical branches because of the lack of awareness about the program and the admission procedures, about the requirements, what are the possibilities, what are the chances of getting into admit. So application has to be very, very strategic. So now USMLE is a licensing examination with a weightage of 10 to 15%. From 26 Jan 2022, they have implemented this. And now there are 3 parameters to get the ECFMG certification. Educational Commission for Foreign Medical Graduate Examination there. So basically 6 pathways are there to get the eligibility certificate. So all the Indian students will come under the pathway number 1, which is already licensed to practice medicine in another country. 3 parameters are required. One is medical examination, that is through the USMLE step 1, step 2. Another parameter is that you should have a communication skill, that will be through the OET examination. And third is to have your clinical knowledge unit to that. So they have introduced the pathway applications, and these 6 pathways are there. So in that, pathway number 1 is already having the license to practice medicine in another country. So most of the Indian students who have pursued their degree here, or students who have got the license in India to practice, they will come under this category. Now specifically, I am covering this pathway 3. So many students who have pursued their education, completed degrees from Russia, China, Kazakhstan, Philippines, like degree countries, and finding it difficult to come back to India and all that, to have the give the foreign medical graduate examination, to do the additional 1 year of internship, to have the license here. So those schools, medical schools, who are in the pathway 3, if you go to on the ECFMG and go to the pathway and check the pathway application pathways there, go on the pathway 3. So if your college is there in the pathway 3, in that case, by giving USMLE step 1, step 2, and that you can apply for the eligibility certification. In that case, there is no need to have the license to practice in India. So this can be a path. So many institutions are there in the pathway 3. You check whether your institution is there in pathway 3 or not. Even some students who are planning to go for MBBS, they should always see whether their college is in pathway 3 or not. Because it is a major problem in the future. Those countries who are not giving the license to practice, these students will be facing major problem across the globe. So a lot of changes are there. Now step 1 is only pass and fail. Step 1, a lot of passing rate is there. 60% based on 54 to 60% based on the pathology, then the gross anatomy, physiology, biostatistics, biochemistry. These are the major components of the step 1 examination, and passing is there. So basically, only attempt the USMLE with proper clinical exposure and download the nbme.org. Give lot of mock tests, evaluate your chances, see your knowledge level at what level you are doing, do the gap analysis, and accordingly give the examinations. One failure will be a black spot on your profile. So previously it was the most difficult exam for the Indians because they were attempting it without proper clinical exposure. In the third year and all that, they were attempting the examination. So our recommendation is that never ever give the examination with any of the in the early stages of your career, because with ample clinical exposure and clinical rotations only, then you should give the examination with proper practice in the mock test. Once you pass the examination with lower score, especially in the step 2, then there is no chance of upgradation for 7 years. So be cautious about it. And CS has been scrapped now. This was a great problem for the student because 12 real life clinical cases were given to the patient, to the students, and the complete jury members were used to observe how the student is performing. So they were making a note of it, how you are doing the diagnosis, how you are taking the history of the patient, everything. It has been scrapped now. Now step 2 has major importance, and you should score 250 plus marks in the step 2. Really, it is very, very critical to get good marks into step 2. Internal medicine, pediatrics, general surgery, gynecology. These are the major components of the step 2. To use proper materials, give the proper mock test, take proper clinical rotations in United States only, and then only you can give the step 2 examination. Without having a clinical exposure, it is not recommended to take the examination of step 2. It will always help you to score great marks if you have some clinical exposure in United States, either virtually or either in an offline mode. Offline mode is always preferable for the Indians. And step 2 is always the strength of Indians because of we are very good in diagnosis, patient diagnosis. Clinical knowledge is very good for Indian students. But still don't be overconfident and don't make hurry of giving it, because scoring ample marks is very, very necessary for it. So major effect is on the countries who were not giving the license to practice to the candidates. So those who are in the abroad countries, they are now facing huge problem for this. So never appear before the internship for at least for the step 2 CK. After 6 months of your internship, you can take the step 1, then fly down to the United States for the after completion of internship at least for 2 to 3 months. During your internship, also take a virtual clinical rotation for the United States, and then give the step 2 examination. Step 1 and step 2 examination. Decent patient exposure is there during this. So hospital rotations are very, very critical part of that. So it should be a combination of virtual clinical rotation and physical clinical rotation. So it is a myth you need to complete before internship. It is a myth. It is not like that. Always you take up the USMLE statement, clear it, have a B1, B2 visa, then fly down to the United States. You will get a hands-on. There is a chance of getting hands-on exposure in the outpatient departments. So it should be a combination of virtual clinical rotations and offline hospital rotations in the United States. It is always not a brand of hospital. It is always under whom you are taking it. How senior is the physician there? If you are under some junior doctor, his letter of recommendation don't have any value. But if you are with a physician who is working since like 25 years, 30 years, he is recommending you, then it has a different weightage altogether. So always give preference to this. It has to be planned properly. Profiling is very, very critical. Without proper profile, now I have certain cases where they have cleared all the three steps with good marks, but they have not worked on their profile as far as research is concerned, as far as publications are concerned, as far as the review articles are concerned, academic, non-academic profile built-up activities are concerned. Their profile is weak. So they are finding it very difficult to get jobs. So profile is most critical part of going into the residency program. In fact, this year we have a complete analysis who which candidate got the interview calls from the residency hospitals for the residency during the ERAS process after that. So it was observed that those students having the proper profile, very good marks in the step 2 with proper rotations, research activities, publications and all that, they were having more interview calls. So it is very, very critical for you. And do genuine work. Lot of people are doing the false work. That is also not advisable to take and purchase certain research and everything and all that. Don't do all these things. This is not recommended for. So targeted score for step 2 should be 250 plus for this. Step 3 examination. Those who have very long gap in their education, means more than 5 years of gap in their basic MBBS and all that continuous education. So they can give all the 3 steps, build up their profile and then try for either the fellowship programs or the residency program. So you need to score really very good marks into the step 2 as well as step 3 also. It is very, very critical. So mentoring and the profile built up as huge weightage now. So what research you have done? It can be non-clinical research, it can be a clinical research. Generally, the peer reviewed research has a lot of weightage. You can do ICMR activities also. You should have proper guides. Making a choice of a proper research project is very, very crucial. Have the publications. How many number of conferences have you attended? That is very, very critical. We never go to the conferences during our MBBS program and all that. So attend continuous conferences, go to the upgrade like portals, go through the research of other authors, write your review articles, prepare a digital CV for all your activities. If you are doing some Bharatnatyam or Kathaka, or you are into the games or doing the blood donation activities, tree plantation activities, AIDS awareness programs, drug abuse, then in the field of Rotary activities, organ donation pledge. So you should participate in all these activities and you should have a proper digital CV created for all these activities. It is very much required. Clinical rotations are very, very important aspect of going into the United States residency programs. Even for the physician associate program, it is critical. Even in India, if you are assisting some doctors, so you should have in a days to the how many cases have you observed? What exactly is your learning for the day? Then letter of recommendations has great value from the Indian faculties, as well as we need to plan it very, very properly. Program selection, proper documentation, residency interviews. No program selection, people don't know where to apply, how to apply. Everybody is applying to some selected universities. Everybody cannot go to the AIMS. Everybody cannot go to the Zipmer Pondicherry. It is a very, very strategic thing. How to prepare rank order list, how to prepare the statement of purpose for the residency program. It is very, very critical part. So all these things has to be taken into the consideration while planning for the residency program. Residency interviews. How to go for the residency interviews? How to get the calls for it? What should be the approach for match and so? How to make the rank order list? It is very, very critical. If certain program is ranking you number 1 and you are ranking it number 1 and the program is ranking you number 10th in the list, that is a non-match based on your interviews and profile. So it is very, very strategic thing to prepare a proper rank order list also. So we help you with the complete USMLE profiling, hospital rotations, letter of recommendation, robust documentation, program selection. Donald Martin and his team, Dr. Devras and his team, very expert panelists are there who will be guiding on each step, right? From research, we have certain mentoring programs at different level. Customized plannings are there for the students. Handling of complete match and soap, shortlisting of universities, programs, interview trainings, follow up with the universities, how to prepare the LORs, how to go in the soap process, supplemental optional rounds, spot rounds. So all this is there. It is very critical. So generally the student will first secure the ECFMG certification, then he will go for the ERAS, and then he will register for the match process. That is a R3 process is there. Means register for that, and then the ranking, and then the results are. This is a R3 system. But the one who has designed this match process is a Nobel laureate, and with more than a lot of parameters are there. 52 parameters are there based on which your applications are evaluated, your profile is evaluated. So these are very interesting results which I will be sharing with you. Since last 2 years I will be giving this. So this is in 2021, I think so. So around 93.9% student, around 39,2005 total positions were there, and around 42,500 applications were there for this. Around 93.9% students got the residency program there. Generally, 4 categories are there: MD seniors, doctor of osteopaths, then US citizen plus international medical graduates, and then the international medical graduates, but non-US citizens are there. And PG by 2 applications are also there. Means in the first year, many students want to go for a desired branch, and they again enter into the match for the PG by 2 positions there in the second year. So these are the positions. So in the next year, 42,952 applicants were there for 40,375 seats, and 93% students got the this seats there. As far as the international medical graduates are there concerned, 59.4% students got the admission. Means around 60% of international medical graduates got the admits there. Now in the latest 2024 March results, which were declared, around 44,853 certified applicants were there, with more than 41,500 applications are these positions were there. Around 92.3% students got the match, and international medical graduate percentage was 58.5%. So great percentage in India. In India, for clinical branches, non-clinical branches, 32 branches, 70,000 seats are there, with average and 66% reservation, and 250,000 students are there. And here 44,000 applicants are there, and only 41,000 seats are there, and still more than 2,000 seats were vacant in United States for surgical and clinical branches. This is generally a calendar published for the 2025 and all that. 24 intake September. This is a ERAS process calendar is there. You can visit the ecfmg.org and got this calendar. I will not speak much about this. So surgical and clinical branches are possible for. I will show you the exact data here. I am going to share with you. If those doing the gossiping, it is very difficult to get into the surgical branch and all that. With proper profiling, with proper planning and execution, you can surely get into the clinical branches. So this is the data. So this is a placement and match graph is there for 2023, where and placement ratio is there. So around 59.4% is the match rate for 2024. Placement rate for all applicants is around 52.5%, and around 62.4% placement rate is there for the active applicants are there. Now these are the data from 2005 onwards till 2024. So till 2024, in 2024, 5,742 students, international medical graduates, got the admits in all the specializations in United States of America. Okay. So, and non-matches, 4,000 students were not matched there. So basically, plan your USMLE properly with proper internship exposure. Then fly down to the United States, take clinical exposure. Then you do step to CK, work on your profile, and then plan your admission process properly. You need to check your college credentials in bidums.org, and you go to the sponsors note and check whether your college is there or not. Always go to the sponsors note and check the current status of your college institution. It is very, very crucial. Now, this is the exact data of the branches secured by the students. So, if you will see 5 branches, that is internal medicine, then the pediatrics, then psychiatry, neurology, family medicine, and general surgery. These were the highest branches secured by the international medical graduates. Internal medicine was 3,109, and 494 seats were vacant here. What I am talking about is C here. Then you go to the this. I will show another key. In pathology also 171 seats were there for international medical graduates, 7 were vacant. In pediatrics, around 500 students got the admit in pediatrics, 251 seats were vacant. As far as the surgery is concerned, in surgery, you will see this. This is the around 97 international medical graduates got the categorical admission. There is always 2 categories are there. One is a preliminary year, one is a categorical year. So in the preliminary year, around just a minute, 200 students got the admit, and 549 seats were vacant in the surgery. So those who are saying that international medical graduates cannot go into the clinical branches, that is a myth. That is a false information point. This is the exact data available. Most authentic. The total positions, including the PGY2 positions, were 6,054 for international medical graduates. So get your academics credential verified with the EPIC. Open your account with the EPIC and get it verified. That is always a very, very authentic. That is a ECFMG service. So it is required for getting into the ECFMG certifications and all that. So open your account with the EPIC and all that. It is an electronic service available for the profile verification. Always believe on the official websites, that is nrmp.org, ecfmg.org, usmle.org, nbme.org, nmc.org, aapa.org. So all the informations, every information, single information is mentioned into this. So always rely on this. Go through complete bulletins, study each and everything there. Don't rely on the Google Babas and all that. Because every time the time is changing so fast, lot of new regulations are there. Everything is new. So all the new parameters are there. So you will get exact data into all this. Even about the physician associate program, you can visit the aapa.org and get the complete authentic information what I have shared here today. Everything is mentioned there. So these are our websites, Astute Career Counseling Academy, and we have our offices in Mumbai, Pune, Nagpur, Akola, Jabalpur, Kolhapur, Vadodara, everywhere. So you can take the screenshot of this, and for one-to-one appointments also we can schedule one-on-one appointment. We can discuss your further career pathways. We can plan your proper careers in case of any confusions or difficulties, or we can surely help you with the counseling sessions. So we will be conducting free counseling session for you, those who are attending this webinar and all that. So now take the screenshot for this. So again, I will summarize. Today we spoke about Indian admission scenarios. What are the possibilities? What are the budgets? How many seats are there? What are the admission criteria? Global acceptability. Then I told you about the physician associate program, the non-USMLE route to practice medicine in United States of America. It is a 2 to 3 years of program. You will require to complete the prerequisites, do the best evaluation, give GRE, TOEFL, and PA interviews, and then we can plan it accordingly. It is a lot of scholarships and everything is available for you. You can start the prerequisite immediately and fly down in Jan or March next year. Then secondly, I told you about the residency program. Most of the students are quite aware about it, but I exactly gave you the strategies for admission and I discussed the proper statistics given. What are the total statistics available today? Exact reports published by the nrmp.org. So basically, all these things are very, very important. So you can surely have a session with me, one-on-one session with us for the programs, for the career planning, and any kind of guidance you require, you can surely connect with us. So now we can take the questions and answer session. And just a minute, I will be taking. Renuka, need information regarding teaching options in medical colleges in US, UK for preclinical branches after MD, like anatomy, physiology, biochemistry, pharmacology. My advice is that, Renuka ji, you go for a PhD program in United States and then you can start teaching there. So basically, if you want to go into the academics and all that, you can surely, because all these branches are very, very research oriented, specifically pharmacology or biochemistry, microbiology, all these related fields. You can perceive the PhD programs there based on your profile. We can upgrade the profile and all that. And you need to write proper synopsis and all that. We need to evaluate the chances of getting into the, we can make multiple applications there. Generally, the PhD programs are with sponsorships. You will be getting stipends there if you have a good profile. And then you can think about going into the academic jobs in United States of America and teach there in the pre-clinical and all these subjects. You can surely go into the academics or you can do the research related jobs also. All this is there. Can one get into the pathways and join residency program after PA certification? After PA, if you are a basic MBBS student and after physician associate program, you can surely, because you have they are the preferred commodity of professionals there in United States. It is a very, very prestigious program with ample clinical exposure. So that will surely add a value. It will give you a financial stability in the United States. You will be having one job in your hand. You will be earning good money during the physician associate program. You work on your profile, do lot of research activities, do the research assistantship, take lot of scholarships, do certain publications, give the PA program, take the license, and simultaneously you apply for the residency. So you can surely go into the residency program and it will surely add up a value in your profile. And that will be a for settling down also in United States. It is a faster pathway. It is a good pathway for you. Because if you have a longer gap in your education, then physician also going to the residency program is really very difficult. If you have more than 5 years of gap in your continuous education specifically. So in that case, you need to work on step 1, step 2, step 3. All you clear all this, work on your profile, do some research, publications, and then go into the residency process. And you can apply for the long-term fellowship programs as well in the NRMP, or you can also go for the residency program. So physician associate program can surely give you license to practice. So you will be having a license to practice there with the proper jobs and simultaneously you build up and then go into the residency program. That is good. No, for physician program, associate program, no. Yesterday only one fellow and great professor from the DY Patil joined me for this physician associate program. He is going there for. So MD, and because if you want to settle down there and all that, it is a great program. There is no age criteria. education in the United States of America. So, any age limit for medical preclinical branches? What is the pathway to get jobs? Just a minute now, my battery is getting low. I will charge it. Just a minute. Any age limit for medical preclinical branches? No, there is no age limit for medical and preclinical branches. In United States, basically, um, uh, if you are talking about the graduation pathway, in that case, there is a pre-medical. Suppose a student is going for a pre-medical part, so 2 years are common, and then the 2 years are with prerequisites. So, so they will be taking. Suppose one is going to, after 2 years, he can think about going to the dentistry, physiotherapy, occupational therapy, medical sciences, physician associate program. So 2 years are common. They will give the multidisciplinary education there. They will give you exposure to different things. And in the rest of 2 years, you will choose the branch if you want to go for MD or doctor of osteopathy. And then generally after the MD or DO, then you give the USMLE step 1, step 2 and go for the residency program. Or after the completion of the pre-medical part, then you can go for the master's program in the related subjects. Like even after the pre-medical, if you don't want to go for a residency program, then you can think about doing the specialization in biological sciences or genetics, biotechnology like branches, or biochemistry like branches, microbiology like branches, anatomy. You can do the master's program into that. So there is no age limit for such in United States. For that is a most flexible education system. In the United States, anybody can do anything. Engineer can become doctor in the United States, and doctor can pursue the engineering in the United States. It is such a flexible system in the world. So there is no age limit for this. What is the pathway to get jobs? So jobs are based on your profile, but basically in physician associate program, generally lot of jobs are there. You are allowed to work for 3 years in the optional practical training there. The hospitals will be giving you the employment. They will be sponsoring you the H1B visas. In 3 years of time, you will get at least 4 attempts to apply for the H1B. And it is a non-capped H1B visa there. The fantastic thing about the faster green card processes are there for the physician associates. As far as the residency program is concerned, residency program is totally free and with the stipend. So during the this program, you are earning around $60,000 to $120,000 yearly during the residency program. So you are earning there. As far as other programs are concerned, like MPH, Master of Public Health, or you are talking about the PhD programs. So generally, PhD programs are based on the stipend. They are giving you the fellowships, monthly fellowships there. And after doing into that, you will be doing the postdoc work, or you will be into the academics and doing the research-oriented jobs. Apply for that. You will come into the same process. You will be getting the separate OPT for the PhD programs also. So no issues at all as far as the age limit and all this is concerned. Can I get just a minute over? After PA license, can we practice in India without Indian practicing license? It is a gray area in the as far as the our NMC regulations are concerned. They have given those professionals having the license to practice in United States, Canada, Great Britain, New Zealand, and Australia, they can come back to Indian practice. They have not mentioned it is a residency or physician associate, but it is generally the physician associates, those MBBS students. If you have done your MBBS from India and having the license to practice, you can surely come back to India. But those students who don't have license to practice and going for a PA program, they have a target to settle down in the United States. 99% of students don't come back. If you are earning there 2 crore rupees, $2 lakh a year in the starting, nobody wants to come back to India in that case. So generally, physician associate program with a non license in India, those don't have the license to practice, They have a target to settle down in the United States and pursue the medical career there. That's why they go there. Fees for the PA program. Generally, the PA program fees is around $30,000 to $50,000 per annum. Lot of scholarships are on offering based on your academic and non-academic profile. Education loans are available for you, and education loans repayment will be starting from your jobs after 3 years. And a lot of highest, I already told you the survey reports also. So that is not report published by me, that is by the authorities there. So very, very authentic reports are there. Great jobs, easily you can repay that. Yes, you can get license to practice in 2 years work. Fees for PA program, MBBS graduate with Indian license to practice and 2 years work experience. PA, basically your MBBS is not valid in, you will have to take the ECFMG certification. So you are getting the jobs based on your PA program, master's program. You are not getting the jobs there on the basis of just MBBS, completion of MBBS in India. MD and DO also cannot do the work there in United States. Those who are doing the undergraduation part like MD program or DO, they cannot do the practice there. They don't have the practicing license. How many years of PA program of with Indian license to practice? It depends on program to program. Generally, the duration is between 2 years to 3 years. Maximum programs are between 24 months to 27 months. Sir, send brochure, sir, regarding PA. Surely we will send you the brochure, all the details, all the white paper regarding that. Also, you visit aapa.org for the complete site. Sir, MBBS graduate from Philippines and cleared FMG recently and got PR. Can we now apply for PA? Surely you can apply. Anybody can apply for PA. You can surely go for a PA program in the United States. No issues at all. It is great that you have done with the FMG recently and got the PR also. You can surely go for the PA. No issues at all. Permanent registration is there with you. No issues at all. Surely you can think about this. There is no stipend in PA. In PA, you can work there for 20 hours in a week. Curriculum practical trainings where you will be earning your daily living. And post completion of your program, you will be doing the jobs in the hospitals and they will be giving you salaries as per the US laws, generally 1.25 lakhs to $2 lakh per annum. And then they will be sponsoring you the H1B visas. Stipend in PA. Sir, what is the pathway for Philippines to USA? It is a great question. I really appreciate Yogesh for this question. So generally, there are few pathways. If I will take one by one pathway is that for the 12th students. So those students who have completed their 12th and given the NEET examination. Now yesterday only a good news is there for Philippine student. Now Philippines have made a legislative decision and they are now allowing the Indian students to practice in Philippines. So that was missing. So as far as the National Medical Commission notification or this resolution in 2021 resolution, NMC resolution is concerned, they have given certain parameters. So one of the parameters is getting the license to practice in another country. They can only come back to India. So now this.
There is some internet issue actually. Sir will join shortly. Please stay there for question and answer.
Hello, just some technical glitches there. So for Philippines pathway, one is key, you can do the pre-medical in Philippines and then you can go for by giving the MCAT examination, you can go for 4 years of MD program in Philippines or Doctor of Osteopathic in USA after giving the MCAT examination and then do the residency program there. Second is you can do the pre-medical in Philippines and then go for a 2 years of physician associate program in United States. That is another pathway available for you. Third pathway is that you can complete your BSMD in Philippines and you can go give the USMLE take a complete international program. There are certain international programs are there where you can take the final year internships in the United States and then give the step 2 examination and go for the residency program. or complete your
ఇంకా
pre-medical and medical in Philippines, and then go for the physician associate program to the United States. So Philippines is exactly the US education system, and that is a pathway, affordable pathway to reach United States.
ఏం చేస్తాం
hope-
అమ్మా
Yeah. Sir, MBBS graduate from Philippines and cleared FMG recently and got PR. Can we? Yes.
అమ్మమ్మనా
How many years of PA program? Any other question?
ఎత్తట్లేదుగా
Please keep yourself muted.
ఎత్తట్లేదు అత్త మౌనిక ఎత్తట్లా హోటల్ పెట్టింది అమ్మమ్మ
Any more questions there? You can surely put your comments regarding the seminar, whether you have liked it, whether it was informative. And we can have if somebody wants to ask the questions, surely we can, I can answer some more questions also. Yes, just a minute. Can I get clinical exposure from PA program and then give USMLE step to go for cardiothoracic? Yes, sure. You can get a clinical exposure. You do the physician associate program in a related branch and get the clinical exposure for that. So that will surely help you for the residency program in the related branch. See, it depends. Or should I focus on the residency program with USMLE steps in mind? See, it all depends on your profile actually. If you want to go for a USMLE, see, residency program is that residency program requires certain level of profile and everything. So first we need to evaluate the chances of getting into the residency program. So if you are focusing on USMLE step 1, step 2 currently, you can give the attempt for that. But if more gap in your education is there, then it is always advised to go for a physician associate program and then prepare, have a clinical exposure in United States and then go for the residency program also. So PA is also a PG degree. That's why you can take up the PhD programs after that also. That it has got a lot of value in United States. So it depends on your profile. Secondly, decision is based on your financial capacity. If your parents can afford the education loans or that much cost of physician associate program, then only you can think about that program. Otherwise, residency can be the pathway for you. So, and timing, when you are planning, suppose you are a passed out of current passed out, or there is lot of gap in your profile. So then you can plan the 2026 September intake for that. As far as PA is concerned, you can immediately start with the prerequisites, fly down to the United States in the next cycle of admission, start the program till 2027, and you will be having license to practice in the United States. In the meantime, you give the USMLE step 1 and step 2, and then if you have a dream to become a residency, go for that. That is also possible for. So it all depends on your plannings, your profile, your multiple aspects have to be considered while taking a major decision. So we can discuss in the meeting with your parents, and then we can arrive on the decision for that. And ultimately, goal, if you want to settle down in the United States, the PA is a very great pathway for that. See, basically everything is given as far as, sir, can we get into the touch with alumni? See, United States is a very, very transparent education system. If you will go on the aapa.org, if somebody is going for a master's in computer sciences or information technology or microbiology or biotechnology and all that, you are not going to the New York University and speaking to the alumni. So you go to the university programs, go on aapa.org, all the university programs are given. You go to the website of particular university, a lot of interaction, there are the sections given for the alumni and all that for communication with the universities. You communicate with them. So it is a very, very prestigious programs there. These are the master's degree. That does not require any certification from any of the organizations in the world. They are very, very established programs. So you can go on aapa.org, visit the program sites, go through all the details of each and every program, go to the requirements, go to the website of the programs, and take whatever information you want, satisfy yourself with that. Currently, we have a lot of students who are doing the PA programs and all that. Senior doctors are also doing. Philippines pathway brochure and lecture, I will send it to you, Yogesh. Surely you connect with me for this. So I will we can have a one-on-one discussion where I can explain you the complete pathway for the this, and then I will share the Philippines brochure with you. Education loan up to 7.5 lakh Samiksha. This is a very good question for the education loans. So up to 7.5 lakhs. Education loans are without any mortgage. With one guarantor only, you can get the education loans. As far as loans are concerned, though you can have a mortgage with the bank. Lot of nationalized banks are giving the education loan at 9% to 11% rate of interest, which is chargeable only on a disbursed amount. So the repayment will start after 3 years of time. And Samiksha, if some blood relative is there who is having a long-term visa in United States and he is ready to take your guarantee in United States, so doing the job there, having the income proofs there, and he's if he take so you can get the education loan at a very cheaper rate at 3 to 4% rate of interest annum per annum basis, half the cost of India. So and lot of scholarships we can also try for a lot of scholarship which will be based on your academic and non-academic profile. As far as residency is concerned, it is a free program. And this is applicable for all the programs. Means anybody wants to even have an education from India. So education loan depends on all these things which I have told you, shared with you. So our team will be connecting with you for the feedbacks, and if somebody, so please cooperate with them. And in case of any requirement of counseling sessions and early planning of your careers, if you want some mentoring programs, we have a complete pathway for residency program where our faculties from the United States will be mentoring you for the complete USMLE mentoring will be there, research mentoring will be there, publications, hospital locations in the United States, everything will be taken care and handling of bags and so all the documentation process, everything is there. The customized plans are there for the students. So we can discuss one-on-one and then we can discuss the profile and then we can move on. How much will be the Subhash Dive? How much will be the cost for the total all around Subhashji, 32 into $400 you can take into consideration. That is the cost of the prerequisites. Is the education loan taken from Indian or US bank for this program? Both Samiksha, you can take the loan from Indian banks, you can take from the US banks. If your guarantor is there in the US, then it is available in the United States. Otherwise, you will be taking the loans from the Indian banks and you will do the repayment. Your parents will not be doing the repayment. You will be doing it from your salaries. Within 1.5 years of time, you will pay the complete repayment. Even you will pay back your medical education expenses till the undergraduation done in India. So thank you everybody. This is I will be how to contact for one counseling. Yes. So basically I will be putting this number here. Another number of Pranali. This you can connect to Pranali. So you please take the screenshot of these numbers and you can connect on because of some technical glitch my presentation I cannot stop my laptop in that room. So you can take this. No charges for the one-on there is no charge for the one-on-one consult. It will be a free session for you. Samiksha 90215 90009. So thank you very much. You can put your comments about the program, about this, whether the seminar was informative or not. You can surely put your comments in. and we can connect one-on-one. So thank you very much. Thank you, Namanji. Thank you, Samiksha. Thank you, Subhash. Misaki, thank you. Yogesh, thank you for your comments. Sarangji, thank you. KP Muni sir, thank you. Arvind Sekharji, thank you very much for the comments, for the appreciation. Thank you very much. Thank you. So I will be completing. Good night. Wish you a very bright career ahead. If you need any help, we are available for you. Thank you very much.